Adele. I'm Dr. Illy Fields. We're here to get started with your hip surgery. I'm just going to start by asking you a few questions before we get started. Are you currently having any pain? And if you are, on a scale from 1 to 10, how would you rate your pain?
Well, with the pain medicine you give me, it's probably about a 6.
Okay, so that's better than last time. That's an improvement. All right, so
What, nigga?
first I'm going to have my assistant here take your vitals, and then we'll proceed with a pre-procedure x-ray, and then we'll get started.
Okay, perfect. Everything seems normal. Temperature is at a 77 and blood pressure is 180 over 92. It's a little high, but nothing abnormal. Oxygen levels are at 99, so everything looks good here, doctor.
Okay, perfect. Do you mind turning on the radiology equipment for me, and I'll get started with the x-ray?
Absolutely. Let me prepare everything.
All right, Adele, while she's doing that, I'll give you a little rundown. I'm just doing an x-ray to start, just to make sure that you've had no further injury to your hip and everything is still where we left off at. So you had a transverse fracture of your hip. I just want to make sure there's no other fragments, there's no other breaks, and then it's just that one clean line.
Okay, I understand.
Okay, perfect. Everything's ready to go.
Okay, perfect. So I'm just going to hold your legs still. I know you're in a little bit of pain, but we need to hold that straight and still. Take a deep breath for me, and if anything hurts, just let me know.
Excuse me, ma'am?
Perfect. Can you just move her hip, like her whole body slightly more to the right so I can get both angles?
Will do.
Hey, guy with the red hat, come here.
Perfect. All right, we have all angles.
Medic, can I go in?
Okay, so I'm looking at this here. It's still the same break, a commuted transverse fracture to your hip. I'm going to have my assistant here give you a gown. We'll step out and we'll start getting in our PPE and we'll get this rolling. Do you have any questions before we begin?
How long do you think this surgery's going to take?
And not too long, so I'll explain it before we even get you started. What we're going to do is make a small incision. It's just one fracture line, so I'll just be putting pins and rods to hold those two pieces of bone together, and then we'll close you up. So it should not take longer than 15 minutes.
Now, the anesthesiology part, putting you to sleep. Now, once I put you to sleep after I check you, that's going to probably take a little longer than the actual surgery. That part, you may be asleep for up to an hour. It just depends on how your body reacts. I am going to explain it more to you as it goes on, and I'll be with you every step of the way as I put you under. I'm going to make sure that you can safely be put under before we proceed.
Okay, I'm ready.
Okay? Would you like me to give her her gown, Dr. Illy?
Yep, and then we'll step out and we'll get dressed in our PPE and we'll begin.
All right, so we're gonna step out, and while you're doing that, I'm gonna start preparing everything, okay?
Okay.
Can I go in? Can I go in the room? I want to watch too.
Okay, thank you so much.
I want to go in there.
All right, she's done.
No, well, shut your ass up. Go outside. Go do something productive.
Okay, so it looks like you successfully are able to get your anesthesia. I don't see any issues here with your health. You're not on any medications that could potentially put you at risk. Do you feel comfortable with being put under? Have you been put under before?
Yes, ma'am, but it's been a long time.
Okay, do you remember when you were coming out of your sleep if you experience any nausea, sickness, or anything so we can prepare when you wake up to ensure that you are safe and comfortable?
No, I didn't experience that. I was just really like sleepy, like I didn't want to wake up.
Okay, yeah, that's completely normal. So, like I said, that's going to take the longest, is you just, coming to after I'm done. Um, I'm going to check in with the doctor, make sure we're ready to start putting you to sleep, and we'll go from there.
Okay.
Doctor, would you like me to start preparing her to go to sleep so we can get this going?
Yes, please. I'll work on sanitizing the tools while you do that.
Perfect. All right, so you're going to feel a little pinch. I'm going to insert an IV into you first, and we're going to go from there. I'm going to count down as you fall asleep, okay?
Okay.
Pinch right there. Perfect. You're doing absolutely amazing. Perfect. The IV was a success. Everything is put in properly. All right, so I'm going to now start putting the medication through your arm. It's going to feel like you had a couple glasses of wine, okay? You're going to feel a little woozy. And then I'm going to place a mask over you. It's going to help you with breathing. And it's also going to help you for being able to stay asleep. Because sometimes people wake up during surgery, and we're going to ensure that that doesn't happen to you, okay?
Okay, I understand.
All right, so I'm putting it in right now. Like I said, you're going to kind of feel like you had a glass or two of wine. You might get a little sleepy here. Okay, we're going to put the mask over your face. I'm just going to get you to take some deep breaths for me, okay? And I'm going to count down from 5. 1, 2, 3, 4, 5. All right. Can you move your hand for me? All right, it looks like the patient has successfully been put under.
Okay, perfect. We can begin.
Right, I'm just making sure her airways are good. She's breathing properly. Okay, well, perfect. Yeah, everything looks good here. So she's completely put asleep. You're more than welcome to start now. I'll put on my gloves.
Okay, perfect. So I'm going to start by applying betadine to the surgery site before I make my incision. Do you mind handing me the scalpel?
I'm muted in chat.
Oh, no worries. I'll start now.
Perfect, I'm sorry.
You're fine. All right, incision is open. Now I need to maneuver the displaced bone back into proper anatomical alignment. I'm going to hold them together. If you can you please hand me the metal screws and pins?
There you go.
Perfect. Okay, so I'll insert these now across the fracture line. All right, perfect. So if you don't mind, Miss Sharon, can you please turn on the fluoroscopy equipment? How's our vitals looking?
Yeah, I just checked them. Everything is looking amazing.
Good, good.
She's still completely under. Her breathing rate has gone down, which means she's completely put under, but her heart rate is stable.
Perfect. Just what I like to hear. Okay. Thanks for that. I'm going to use that fluoroscopy now. We need to visualize the bones. Just make sure I maneuvered them into proper alignment and the pins are holding them in place.
Perfect.
Okay, I'm going to adjust one of the pins here. Perfect. All right, so I'm going to close this. Everything looks to be in proper alignment. I just need to close her wound and this with some sutures and staples. So can you hand me the sutures, please?
There you go.
Perfect, thank you.
Absolutely. This is going amazingly.
Yeah, so far no complications. I'm glad our vitals are stable. Thank you for monitoring those.
Yes, absolutely. Everything looks good. I am going to get an antibiotic bag prepared so that way there's no chance of any issues after the surgery. We don't want her to get infected.
Yes, perfect. That's exactly what I was going to ask next. Okay, the incision is closed. When you're ready, we can begin the wake up process.
Perfect. Alright. I removed the mask. I had stopped giving her anything a couple minutes ago, so it should be about 5 minutes or so until she comes to. Everybody acts a little different, so I can't give an exact answer on when she's going to wake up, but she should come to shortly.
Okay, perfect. Oh, she's starting to move.
Where am I at?
Good morning. How are you feeling?
Nah, I feel like crud.
All right.
All right, Adele, it's Dr. Illy here. So I'm just going to let you know how your surgery went. Your vitals remained stable the whole time, so we didn't have anything to worry about. The pins and screws worked wonderfully. I just had to adjust one screw and the rest went smoothly. I did end up closing the incision with sutures instead of staples. And yeah, so I'm expecting you to have a 6 to 8 week recovery period. Miss Sharon here is getting you set up with an antibiotic bag, and we're going to send you home with some painkillers. As you're waking up, how are you feeling now?
You're already done with it?
In here, I'm just rinsing out your IV with some saline, okay? You might have a little salty taste in your mouth.
Yes, ma'am, we're already done.
Ugh.
All right, so this IV drip is going to take about 15 minutes to go through your system, and it's just going to ensure that you don't get any infections after the surgery. Everything was sanitized properly, but you never know. We don't like to take any chances.
Yes, ma'am.
All right, Adele, I'm going to start a quick exam while you're awake. Are you feeling any numbness or tingling at all?
I don't really feel nothing right now.
Good, perfect. So no pain at all.
No, but I'm still, a little bit drowsy.
Okay, and that's to be expected. The anesthesia does take a little bit to wear off, so I would give it a good maybe 20 minutes and you should be back too.
I feel like I've been at the bar all night.
I did tell you you'd feel like you had a couple drinks. Alright, and it looks like your IV is done. I'm just gonna re-clean it out with another saline rinse. You're gonna have that same salty taste in your mouth. And I'm
Ugh.
gonna remove. I know, it's awful. I'm sorry, sweetheart. I'm gonna be removing your IV now, okay?
It's the worst taste because I haven't had nothing to eat or drink for the past 24 hours.
Oh, I'm sorry. There we go. Alright, I'm just gonna apply a bit of pressure here. Put a little cotton ball on you. Make sure that you're not gonna be bleeding. It should go pretty quick. You should be good. Right, I'm just gonna tape it up for you right now. And there you go.
Thank you.
You're very welcome. I'm sorry that that might have tasted a little bad. You did real good.
I'm definitely going to get me something good to drink after I get out of here.
Did you want me to get you a cup of water? I don't mind. A cup of ice water, I think, would actually probably help you come to.
Yeah, if you don't mind.
Here you go. I'm going to adjust your bed for you just a little bit so your head's tilted up. I don't want you to choke, okay? And there you go. Alright, here's your water with some crushed ice. That should help you feel a little more awake. I'm just gonna do another check of your vitals, make sure that you're still good.
Okay.
And while she's doing that, I'll begin a physical exam of your hip. Let me know if anything hurts and I'll stop where I'm at.
Perfect. Your breathing is good. Blood pressure's good. Heart rate is low. It's at a 72. This is good. The only thing is her breathing is a little low, but that's expected with anesthesia. It's at a 97, so it's not in the dangerous zone. She's just gonna probably be like that for a little bit, but she's completely healthy otherwise.
Good, good. And I'm checking her hip here. It has good range of motion. I see no deformity, no swelling. Are you still
It
at a
doesn't.
0 out of 10 pain?
Yeah, it don't really hurt. It's like a weird feeling.
Yeah, so that feeling will take a little bit to get used to. You have about 4 pins and screws holding your fracture line together. So it's just that metal inside of you, and then you're also feeling a little bit of tightness maybe from the sutures. I am going to go ahead and provide you with a rolling walker. I would like for you to try and be moving within by the end of the day. I don't want you to stay in bed. I don't want you to basically get that leg stiff. You want to be up, you want to be moving. It promotes healing and it promotes circulation. So by end of day, I want you up and moving. If you do need assistance, please use that rolling walker. And then as far as your sutures go, in about 24 hours, you can start to shower as normal. Let's leave them be for now, but don't scrub, obviously. And then I'll have you back in about 2 weeks so we can remove sutures.
Okay, that sounds good.
Miss Sharon here go over any pain medication she'll be sending you home with.
Perfect. Okay. Just give me 1 second. All right, perfect. So I'm looking at your medical chart. It says here that you're not on any other medication. Do you have any health concerns or issues that I should be aware of prior to this surgery?
No, I'm pretty healthy until it come to me breaking this hip.
Perfect. Okay, so I think the best course of action here that we're going to do is we're going to give you oxycosets. They are a little strong. I don't recommend that you drive while you take these medications. You're going to be taking one every 4 to 6 hours as needed over the course of the next 7 to 10 days. I am going to give you enough for 10 days, but I highly recommend you stop taking them after 7 if you can tolerate not needing them for pain. You can get over-the-counter ibuprofen to help manage the pain if you don't feel like you need to take the oxycosets. And then I'm also going to be prescribing you a steroid. So it's going to help basically stimulate healing everything internally for you. It's going to help your hip be able to move, and hopefully we can get these things out of you sooner than later when you come back for Illy's checkup. So I'll get those prepared for you. You're looking good here. The steroids you're going to be taking, it's prednisone. It's going to be 50 milligrams every 12 hours. Please take it with food. It can cause some constipation and or diarrhea. Each patient is different. It's just based on your gut health, basically. So if you're sensitive, you may have diarrhea.
Okay, I understand.
The best course of action is if you do get so it's a little bit tricky because the oxycosets can cause constipation and the other medication can cause diarrhea. So if you're feeling like you're constipated, you can come back and get Miralax, and it'll basically be something you take once a day to help you use the bathroom. But based off of your chart, you look extremely healthy otherwise, so I don't think you should have any issues.
Okay, thank you, Dr. Sharon.
Absolutely. I'm glad I could help you today. You can pick up your prescription from the pharmacy just outside. And here you go.
Miss Adele, will you be paying with insurance or card today?
I'll be paying with insurance.
Okay, I'll go ahead and run that. And when she's done, she can hand you your discharge paperwork. And then I'll ask if you have any questions. So just hold that if you do. I'll be right back.
All right, so here's your discharge papers and your prescription. I'm going to give you both of these. There you go. Did you need assistance on getting out? I can go and get you that walker that she had prescribed for you, just to maybe give you some help walking out of here. One moment. There you go, love.
Thank you.
And here's your
You're
insurance card, ma'am. It went
Where's
through.
the operation room?
All right, do you need my ID for the follow-up appointment?
Yes, please.
Can you go
So
get
I
a
will
dental?
schedule that for about the same time as today for 2 weeks. We're going to just do a suture removal and I'll check your incisions. All right, love, do you have any questions for me at all? I know that was a lot of information thrown at you, so I just want to make sure I get anything answered you have.
We're doing a role play. Please leave, Mr.
I
Sorrell.
think I'm all right. I just might be. It might take me a little time to get out.
That's okay. And again, with the discharge paperwork, it lists everything we talked about here, and I have my number if you do have any questions.
Yes, ma'am. Thank you.
No problem. Don't forget to walk on that, and I hope you start feeling better soon.